Thank you for joining us. Okay, we shall get started. So welcome to the Georgian Fahey Center for Healthcare Innovations 2022-23 Patient Engagement Lunchtime Learning Series. I'm Trish Roach, my pronouns are she, her, and I'm the Knowledge Translation Practice Lead at CHI. We're also joined by members of our patient engagement team, Carolyn Shimon, Ogai Sherzoy, and Marianne Nurmi, if you want to give folks a wave. For this session, we will be hearing from people with lived and living experience who are members of CHI's Patient and Public Engagement Collaborative Partnership. It'll be a less formal interview style session where I'll be asking our members about what got them interested in being involved in engagement, what motivates them, and what truly inclusive engagement means to them. Before we get started, I'm just going to cover a few housekeeping items. So we will have time for a discussion at the end, but feel free to ask questions or comment in the chat at any time. To use the chat box, click the chat button at the bottom of your screen and enter your text where it says type message here. You can send messages to everyone in the meeting or to specific people, such as one of our team members, using the drop-down box above where you type your message. If you're having trouble using Zoom, please feel free to message Carolyn, Marianne, or Ogai. I will enable auto transcription. There we go. And so you should see closed captioning for the session. If you want to toggle this on or off, you can do so using the subtitles button at the bottom of your screen. This series is accredited by the Royal College of Physicians and Surgeons of Canada as a group learning activity, and it may also be eligible for credits towards requirements of other professional bodies, such as the College of Pharmacists in Manitoba and the College of Registered Nurses in Manitoba. If you'd like to receive credit for attendance, make sure your full name is shown. You can rename yourself by right-clicking on where your video is or would be and selecting rename, or you can click the participants button, find your name, hover over it, and then you'll have the option to select more, and you can rename yourself there. We are recording and we'll be sharing a link to that on our YouTube with everyone who registered. And without further ado, I would like to introduce our panelists today. Lori, I will leave because she's off getting, I think she's getting some tea. But we have Kai with us. Say hi, Kai.
Hi, I apologize. I am in my friend's office. She literally just walked in, so I was distracted. But hi, everyone.
Awesome. Thanks, Kai. So Kai is a non-binary educational assistant and high school for students with exceptional needs. Kai uses they, them pronouns and has a passion for advocacy. They use their voice as a trans person in many settings, including as a patient partner with CHI. So welcome, Kai. Thank you for joining us. And Lori is, I went to my screen, Lori's not there. I'm going to introduce her anyway. Let me find her bio here. So Lori is an Indigenous woman who takes great pride in her culture. She was employed as a healthcare aide with Action Marguerite St. Boniface for 37 years. She enjoys caring for people and getting involved with organizations that can make a difference. She describes herself as a pit bull that will keep on trying to make a difference. If something is not right. Lori is the former president of her local MGEU union and was director at Astra Credit Union for 9 years before they amalgamated with Assiniboine. And so we did also have another patient partner who may or may not be able to join. Ogai, do you know if haven't heard from them? Okay, well, if they pop in, I'll introduce them, but otherwise, I will get started. And it looks like Kai, you're going to be in the hot seat here. For this session, I'll either ask a specific panelist to answer a question or pose it to all of you or both of you. We'll see how it unfolds, but we'll treat this more of a conversation than a formal interview. And it looks like our attendance is a little lower, probably because we're right into summer now. So this will be, I think, as Kai put it, more intimate than our usual sessions, but that's fantastic because it'll give folks a chance to participate. If you want to speak, you can use the raise hand feature, and we'll do our best to make sure everyone who wants to is able to. So to do this, you click on the reactions button on the bottom of your screen, and then a menu should pop up with a raise hand button you can click, and use the same button to lower your hand if you change your mind or when you're done talking. All right. So, without further ado, how did you get started in patient and public engagement? Oh, there's Lori. Hi, Lori. I already introduced you, but you want to just say
Hi.
hello? Hi, welcome. Thank you for joining. So yeah, I'm going to start by asking Kai. So I love this. How did you get started in patient and public engagement? What or who led you to being involved with our collaborative partnership?
Well, fun story. So,
Story
Trish,
time.
yeah, so Trish and Carolyn actually know about this. Ogai and I went to school together since like grade 3 or 4. So we've kept in contact on social media, and I got a message from her that was like, "Hey, do you want to be part of this?" And I was like, "Yeah, sure," because like I post a lot about like my work being a trans activist. So it's kind of like one of those things where it just made sense. So that's how I got involved.
I thought the story was going to be longer, but
Well, I don't know. I don't know what else to say. It's
the
fun.
personal connection. Yeah, I think that happens a lot, right? The word of mouth and who you already know and trust. Can you tell us about specific experiences or perspectives related to health services or research that made you want to get involved? And you can talk about these as based on your comfort level and what you want to share.
Um, I actually think one of the things that Ogai and I talked about and kind of like sparked her mindset to ask me to do this was the vaccination forms for COVID-19. So the COVID-19 vaccination forms, to begin with, the gender was all like wrong on there. Basically, it said male, female, intersex, and other, I think, or something like that. And I had actually gone on the news about that. So that was kind of one of the things that kind of sparked my interest on healthcare and stuff like that. And me being trans, like that kind of like brings a different perspective to healthcare. And I think having more research when it comes to trans healthcare is definitely needed. So that's why I'm here.
Good opportunity to bring your voice into the research realm, right? And make sure
Whether you like it or not, I'm here.
we love it. And then what kind of other, I guess, activities, advocacy were you involved in before you joined CHI?
Well, I'm part of the steering committee for Trans Manitoba still. I haven't really done much. I'm kind of like the silent partner, I guess. I haven't really done much, but advocacy wise, I just get some random calls to be on the news sometimes about things. So I'm like, okay, I guess this is me doing it. But I guess I do work at a school. And one of the things with my school is I'm part of the Equity, Diversity, and Inclusion Committee. So it's bringing voices to the trans students and staff that work here. So that's kind of like my contribution and what I can do. And I do that outside of work too, like with like United Way sometimes. They've like phoned me for like speaking engagements, but otherwise I just kind of like, I don't know, just this is my thing. This is my jam.
No, and we're glad to have you. When did I'm trying to remember when you joined. Was it like 2020?
I don't know.
Oh.
Whenever Ogai was off.
Sometime in 20, I think it was, yeah, right in the midst of COVID there where we had you join virtually. So Kai, I actually haven't met you in person yet.
No.
Which is wild. And now we're in 2023. Wow. But I have met Lori in person. So I'm going to turn over to Lori. So Lori, do you want to tell us a bit about what got you involved in CHI's collaborative partnership? I think you've been with the partnership longer than I've been working in PE.
I think I was one of the foundings, right?
As far as I know, yeah.
Yeah. How I got involved was a community newspaper. I had to think about this for a good week to remember how I got involved, because it was a long time ago. But it was a community newspaper that I had seen this ad in, and I answered it and spoke with Caroline. And who else was with you?
Gwen. I think it was me and Gwen at the time. We met you at
Okay.
a McDonald's.
At a McDonald's, my favorite place. Uh, and at the time, when I worked on a young adult unit at Taché Center. And my reasoning for getting involved was the healthcare system is slow. They plan and plan and plan, and then the plans don't end up doing anything other than planning it. So, you know, I thought maybe a voice pushing a little bit further and reminding them that, you know, to do something now, not 15 years from now, might help. And so that's why I got involved, to better the healthcare system and help patients. You know, is there anybody around to give a hand or lend an ear? I don't know.
And then I feel like when the involvement at CHI with the Collaborative Partnership, because we do a lot of work with research, it's kind of a couple steps removed from actual health service. Like we do some health services engagement, right, in some of those projects, but a lot of what we do is working with researchers. So you've both advised on various research projects, on some health services projects. But yeah, I mean, I appreciate you being able to take that passion for advocacy and for making systemic change and then applying it to helping researchers take a couple steps back before decisions are actually made, and making sure that they're collecting information that's of importance, that's relevant, that's going to actually help make that systemic change. Lori, can I ask if you would be able to share some of the specific experiences or perspectives related to health services that made you want to get involved, or that you've experienced? I know I know you have a few, if you're comfortable sharing. Because you worked in healthcare, right? For a long time.
I did. You know what? I'm drawing a blank right now. Sorry.
That's okay, no problem. But I know, yeah, 37, it was 37 years, right?
37.
As a healthcare aide, yeah. So I'm sure you saw a lot of things, and you saw a lot of changes in the healthcare system throughout years working at
Taché
and
Margaret St. Boniface.
Yeah.
When I started working there, though, it was Taché Center. So, but yeah, there's been a lot of changes, but not anything that I can really speak about.
Okay. I'm gonna move on to some of our other questions then, and this is kind of taking us from the past to maybe right now, but it might cover both. So either one of you can answer. Maybe I'll pose it to Kai first, just to go back and forth. What do you think are some of the most important issues to address in? Let's start with health research right now. Like, where do you think research needs to be looking?
I'm like, oh my God. Well, I feel like just like as a trans person, I think a lot of research, there isn't a lot of research when it comes to trans. When it comes to research, I don't think like trans people are kind of included. I feel like it's more like the gendered kind of thing, but like even if you're talking about like childbirth and stuff like that, like I feel like there's a missing link when it comes to like trans men who also give birth, like things like that. Like I feel like there's definitely some missing links when it comes to that, and I feel like there's a lot that trans people can kind of give information to, and kind of help collaborate when it comes to research stuff. So yeah, I just feel like just trans Every answer, trans.
Just yeah,
It's trans.
let's repeat it again and again
Yeah.
and again.
No, yeah, it's definitely something that needs to be changed. Is like a lot of things are gendered that not necessarily need to be gendered, especially like not especially when it comes to research, but in general in the world. But in research wise, it'd be really nice if the focus was less on gender and more on like, like, oh, hi phone. Oh, okay. It's not my phone. So yeah, just less on gender.
And I think too, there's in thinking about research, like there are studies that are done, like your example of people who are pregnant, right? We look at some research studies where they would maybe compare women who are pregnant and their partners, or in those contexts where trans people might be excluded from the research and there's a gap there. But I think also probably there is a need for research specifically about trans experiences that doesn't just include them, but focuses directly on people who aren't cis, right?
Exactly. And I think like right now, a lot of focus in the news is on trans people, but also like about like the effects of hormones when it comes to sports, stuff like that.
Mhm.
I think if you're going to focus on trans healthcare, I feel like if you focus on trans healthcare in sports, maybe like if people are really concerned about that, that should be like the focus is okay, well, let's do research on this. If this is what people think, let's actually see if this is true. So
Mhm.
yeah.
And then what do you think? It might be the same answer, but maybe in the different context of actual health services. What are your thoughts on where we need to focus efforts and what kind of projects and programs should be supported or
Um, yeah.
engaged too?
No,
That
I find so living in Winnipeg, like I can draw on like personal experience because like when I had a hysterectomy, that was a very interesting experience because where I had it was the women's hospital.
Mhm.
So to walk in there looking exactly like I look like right now, having that kind of like barrier of people being like, are you actually in are you actually in the hospital that you should be in, kind of thing, that kind
Yeah.
of like creates this whole like barrier for a lot of trans people and mental health issues, because then they're not going to want to go and get gender affirming care. And I feel like there's no need to necessarily have gendered hospitals when it comes to things like that. And I think like even if you call it the like reproductive health hospital, like why not, like why do we have to have a specifically women's hospital? Because like yeah, it doesn't make sense. So I feel like that's a focus. Is there needs to be less of the whole like putting people in boxes kind of thing. And then when it comes to trans healthcare here in Winnipeg, there's only one place in Winnipeg that is specifically designated for trans healthcare, and it's through Clinic with a K.
Mhm.
And they just got a little bit more funding, but they don't have a lot of funding, and the wait list is horribly long to get any kind of care. And one of the surgeons that does top surgery, he is retiring, or something about he lost an OR spot. So now people who were supposed to get top surgery with him or had a consultation with him have to wait another 2 or 3 years now.
Wow.
So to have that happen here in Winnipeg, like I can only imagine like if that happened in like rural Manitoba or something like that. So I feel like there needs to be more funding, there needs to be more focus, there needs to be more staffing when it comes to trans healthcare. Like that 100% is something that needs to be done. And I think researching, like if you research like the amount of trans people there are and the like healthcare that we have, like you'll see like there's no like there's just not enough. So that's a good
And
rant, right? I'm good. I'm very proud.
yeah, no, and it sounds like not only when care is being provided to people who don't identify as the gender they're born with, or maybe don't look like they fall into one of the traditional gender binary categories, having some staff education, right?
Oh, 100.
Around that, like, because yeah, if you're not aware of the systemic barriers that exist or the kind of challenges that trans people face. If you haven't experienced that in your own life, how are you going to be able to support someone going through that, right? As a staff member, but then also maybe having some engagement in those kind of contexts with people with lived experience of being trans and receiving health services can really, I think that can go a long way to helping, understand it, and sharing stories like yours and having people just, put a face to the to the name, if you will, right?
Oh yeah,
Or,
totally.
yeah.
And like even like one of the things that our school division did, they did it all wonky and weird, and whatever, is something called an equity walkthrough. It's kind of like one of those things, like if you walk through any kind of like research building or a hospital or something, you could go through there and be like, okay, do you have specific bathrooms, or like are there places that are inclusive? Like what can we change to make this place more inclusive? So things like that, like having the knowledge, but also having the knowledge to always learn and kind of like, yeah, I don't know. Yeah.
An openness and a culture of continued learning and education.
Yeah.
Okay, we're gonna get back to that because I feel like you're foreshadowing the next kind of topic. But I'm gonna turn it over to Lori. Hi again, Lori. I'm wondering if you would be able to share, what you think is really important for us to focus right now, maybe in research and healthcare, in both, either. Yeah, maybe we can start with what do you think we should be researching that's of most importance right now?
For me, as a person that survived a really bad COVID experience, I was in the hospital for a very, very long time, and in ICU, long haul COVID is one that is dear to my heart. I still suffer from it, and it's been over a year, way over a year. How COVID affects your heart, the vaccine. I think everybody should be vaccinated personally, but that's another part that I would like to be investigated, because I also had encephalitis. So I didn't travel. I wasn't around anybody because I was on a COVID unit working at the time. So I was isolated. And the only thing that I did have was my vaccine. That was it. So, nobody would ever say that, the vaccine was the one that caused it, but they would just shake their head because they didn't know what was wrong and why my heart failed in regard to the COVID, and there are so many people with heart conditions right now. And it's due to having COVID.
And of all different ages, and people with and without diabetes, with and without pre-existing conditions, right?
And right now, with all the little ones getting sick, it's scary. The world is still suffering from pre-COVID.
Absolutely, yeah. And it was scary when you were going through. I was scared when you were going through that. That was you've survived a lot. You are. I was reading your bio and you described yourself as a pit bull, and I'm like, that is so Lori.
Yeah.
Tough as nails, yeah. And what do you?
I also have multiple sclerosis, so that could be a major factor also, because I am immunocompromised already. But I've had MS since 2007, so I've always been able to work and be relatively normal person. And but yeah, that was tough. And they always ask you, when you are incubated, can you hear and can you feel? Yes, you can. You can hear people. And so when they say, talk to the person, they can hear you, you really can.
Yeah, and I mean, having more opportunities for people who have experienced COVID and have or are still experiencing long COVID to be engaged with research. It's really important to know like these kinds of things where maybe a physician or a research team might not think about it as being important, but somebody with lived experience like you can have a voice and say, there are aspects like this, like when you're intubated, what's the experience like, right? People might not know that. And that could be really important to the research and what kind of outcomes they're looking at. And then, so what are your thoughts on, I guess, where we should focus on engaging or what kind of health services issues are most important to you? I mean, it might be the same answer, but yeah, when we're talking more about health services directly, what are your thoughts?
Engaging more on health services.
Like maybe the way care is provided or what kind of care is needed, or even general thoughts on healthcare in Winnipeg, Manitoba.
I think with the COVID, they were just trying to keep people alive. They were doing anything that they could, from plasma infusions to every test known to man I had done just to keep me alive. So I don't think they understand what COVID is yet. And how to deal with the long haul COVID. There are so many people that I know that retired because of COVID. They have severe memory loss. They can't function in daily life. Does it go away? I don't know. I hope so, for their sake, so they can enjoy retirement, I guess. But yeah, it's not an easy thing. I don't know the answer to that, because I don't know where to start to do research in it. I think the research maybe has to be in the vaccines, because there were several different vaccines that were causing different side effects to people. So
yeah, so it sounds like really the focus there needs to, we still don't know enough to efficiently provide services related to COVID and long COVID,
and that one will be a 15-year thing.
all right, and then some. Yeah. Yeah. Well, thanks for sharing on that, Kate. And I'm going to move on to our other topic that we kind of wanted to talk about, was inclusiveness. So Ty, you kind of alluded to that in your last rant. No, it wasn't a rant. Yeah, so excuse me. You've both advocated, and all of our members have, for the inclusion of voices that aren't traditionally part of decision-making in health research and health services. So to you, what would inclusiveness, what does that really mean, and how should we put it into action?
Good question. No, I feel like the minorities of the world are the more important voices when it comes to especially health research, because there isn't a lot of us, and there's not a lot of us that people will listen to. And I feel like inclusivity to me means like listening to those voices more than everyone else, even though that's not like really like inclusive, because I'm like, man, everyone else is fine. But at the same time, it's kind of like creating like equitable kind of research. So I think that's what we need, is that
Prioritizing the voices that aren't heard over the voices that dominate the conversation, like me, right? Like cis white settler woman.
Yeah, exactly. I feel like there's a lot of Black, Indigenous, queer people that aren't heard, and I do feel like their voices are more important, but I do feel like my voice is important too, but those voices
yeah, I mean, there has to be a diversity of perspectives and
exactly
and opinions. Yeah. And I mean, we've talked about this in various circles, various conversations. because we have a lot of initiatives around equity, diversity, inclusion, and the idea that this really does require addressing systemic barriers and looking at social justice in our health research and health services spheres. I guess maybe if you could speak a little bit to that, like what does social justice mean, I guess, when we're engaging in health research, for example? What do we have to do as researchers? What should we be focusing on and emphasizing in our work? And sorry,
I have no, it's fine. I had this word in my head and I'm like, and gone. No, I feel like, yeah, the people with lived experience. I feel like people with lived experience is like the most important thing when it comes to like social justice. You can't create justice by people who don't have the experience, that don't have that haven't lived through it, I guess. And I'm glad, like with our patient and public engagement thing, like there's so many of us that have so many different like lives, but the way that we can like relate and the way that we can help create research that is more inclusive, that creates more, I guess, social justice, is amazing. So that's your question. I'm like, I don't know.
Yeah, no, it's prioritizing voices of people lived experience. What we're trying to do here, what we try and do in all our engagement, right?
Exactly.
I'll ask Lori the same thing. What are your thoughts on inclusiveness, Lori? What do we need to focus on? Maybe whose voices are missing?
I say ditto for Kai.
Well, we still have like 20 minutes, so.
But you know what? I really enjoy his him speaking. So
there.
You know what?
Oops, you muted. Oops.
Sorry.
There we go. That is okay.
Inclusiveness. You know, I was thinking about with my residents, you know, my residents never got spoken to. They got spoken of. And that I never understood. You know, I would always say, well, why are you talking to me? Talk to her or talk to him. You know, you're asking me questions. You know, I never understood that. So, you know, maybe like I said, you know, lived experience. You know, we all have lived experience of some sort. And whether you can speak or not, you know, you can still give your opinion. So.
Yeah, that kind of echoes one of our other partners, Juanita Garcia. She went through some serious health issues when she was, I think, 13 or so. She has a podcast about it now, which is fantastic. But when we've heard her talk, she's mentioned when she was that age and she was going through her healthcare experiences, often physicians or healthcare workers would talk to her parents. And like she wasn't even in the room, right? Like she wasn't even there. Instead of talking directly to her and asking about her experience and explaining things to her directly. So yeah, I think that's important to. Another thing that we need to do is meet people where they're at, not just maybe, like you're saying, Lori, if someone can't communicate verbally, finding other ways to make sure that they're heard, right? Finding out how they can communicate. So what, with your residents, like what kind of, how would you communicate with them then to, if it was you?
One of my residents, she used to sign the alphabet. So you'd put it all together. So that was her way of communicating. It was signing. But when you work with people long enough, you learn their habits, their ways. They didn't have to speak because we just knew from feel. You know, you can feel somebody, and if they're tensing up, then you know that you're hurting them, right? So voice boards, technology is come a long way now. So, you know, the computer gives voices to people that can't speak, wheels, legs to people that can't walk. Um, but for this individual that she's in heaven now, she used to sign, and she was absolutely beautiful. So you have this young lady sitting in a wheelchair, and we used to go shopping, and people always talk to me, and I'd always say to them, "What are you talking to me for? She's sitting in the chair, talk to her." So then she would go and give some smart ass like she can talk, but I didn't do that. And then she gets so mad at me when I would do that, like I'm okay with it. And I said, yeah, but I'm not, Um, yeah, spelling boards, touching things. And we did have a few residents that were trans, and nobody ever identified them how they wanted to be identified. Why are you putting a pink shirt on her or on them when they don't want it?
Mhm.
That person wanted to be in a denim shirt
Mhm.
and jeans, not a skirt and a pink shirt. So that was another thing that would really bother me.
It sounds like too, this also speaks to the importance of engaging people, not just patients themselves, but also families, caregivers, whether that's informal caregivers or people like healthcare aides, which I don't think we see a lot in health research and services engagement, right? Those folks who work on the ground with patients, who know them, who are with them every day or at least a few times a week, who really get to know people and what their experiences are like, who can also speak to that and help amplify those voices, right?
You know your disease.
Mhm.
I know multiple sclerosis. A cerebral palsy person, they know their disease. They know what they can do. They know what they can't do. So because you live it. It's a life experience, right? So
Yeah, the importance of the voice of the people's lived experience. Speaking of whom, we have Abu joining us. Hi, Abu. Oh, I think you're on mute there. I do have a bio for you, but I'll
Hi,
let you
everyone.
introduce yourself. Go ahead.
Sorry, I'm a bit late. I just came back from the court. I've been in court since last week, and it's been a very both traumatic and exciting at the same time. But your emotions kind of it's sort of like a roller coaster emotions from one. So I I'm on the side of the victim, and it's a murder case, and
Wow.
since last week I haven't been able to do anything work related at work. I've just been with the lawyers and the social workers and things. So I was little. I have this meeting in my schedule, but I thought I would have been home much sooner than I did. The good thing is I'm only about 5 minutes away from the courthouse, so I was able to kind of rush to come in. So I need a bit of a catching up to do with you guys.
Well, thank you. That's amazing that you still, wanted to join us. So Abu is, for those who don't know, is a member of our Patient and Public Engagement Collaborative as well. And he's been with the group for what, 4 or 5 years now? Maybe longer? 6 years?
Since 2019.
Yeah. Oh, okay. So 4 years. Yeah. Abu, we had been talking with Kai and Lori about, how they got involved with a collaborative partnership, and any kind of experiences they bring to the group and why they wanted to get involved. I wonder if you'd be able to share a bit about that, if you'd like.
Oh, yes, absolutely. I think it's maybe this would be one reason to cheer me up. I haven't had a rough day.
Yeah.
I was approached by a gentleman by the name of Hani. I'm sure most of you know Hani. And Hani and I, we go way back when I was working in settlement. And interestingly, I happened to be his counselor at the time. I picked him up at the airport and drop him off to the reception center and mentor him over the years. And at one point, when I was doing my undergraduate, he and I had one class together. And our bond kind of even strengthened from that point on, because I didn't know he was still in the city because most of the people that he came with. So and Hani made this what I'm interested in the most, refugees, war-affected newcomers. It turns out the issues are one of the issues that Hani is passionate about. So we cross paths in many places, and he said, Abu, you are so knowledgeable in this sector. You are so well versed in it. I think I sit with a bunch of people who are really interested in patient care, and so you told me about this group, the child group. He said, I think you can bring a lot to that group. If you don't mind, if you'd be interested, I would like for you to join us there. And so, as they would say, the rest was history from that point on. And I think shortly, but I had a vacation plan shortly after that. I was going to Italy and the Middle East. So ever since I've been part of this group, and I can tell you how I feel about being with this wonderful group of people, especially for the kind of issues that we deal with. Because really, sometimes we might not realize the impact we are having, or what inroad we are making. Because you see, these lived experiences that we share can be a window into a lot of things, and it can speak to some of the gaps in services that is available. And sometimes, actually, I would say most time they are unintentional, but if you don't point them out, then nobody sees them or nobody pay attention to them, right? So I think that's one of the value of this group being together in such a diverse way and such a diverse experience, and every time we have a gathering here also, I'd like to debrief with Hani, and Hani would say to me, one of the things I really like is that the various angles that come together and the things we talk about. Because individually, you can say whatever you have, whatever, but collectively, you see the different people, I remember one time we had, the first time we had this, speaking to the first year pharmacy student, and, interestingly, my office is about maybe 50 feet away from Hani's office, and he works for Regional Health, but he does maintain office at Aurora. So we can always talk about these things. So because he's also very, very passionate about this issue that we talk about. So really, my being a mentor to Hani, and also to see how well he's doing. You know how they say the success of teachers are badges that they wear on their shoulders when they see their students, their mentees doing well, right? So Hani was a big part of me being part of this group. And I think the issues that we talk about, the issues that we bring on the table, and the diversity of those issues really are what that draws me most to being part of this group. And when you're talking about these things, is it Trish who is the joker here, or is it Caroline who is able to to simplify some complex idea in such a way that, I don't know, maybe the journalistic background helps to bring that to us, or Ogai, who is so, you talk to Ogai, it's like you just had a seminar class in social work, and sometimes, personally, I wonder, because the passion you guys bring to this work, considering the complexity of what we deal with, it just sometimes makes you want to give whatever you have, because it's limitless. The zeal, the courage, and you come to this gathering, you listen to somebody like Laurie or Marianne or Kai, and there was another gentleman,
Al?
very, pardon me, yes,
Al Weeb, yeah.
yeah, and the gentleman, the Aboriginal gentleman,
Thomas Beaudry.
Thomas Baudry.
Yeah.
The things that, and personally myself, I was very limited in terms of my knowledge with Aboriginal. My wife works exclusively with Aboriginals in the North End, and sometimes we kind of share some ideas. And my wife says to me, well, I've been in the North End for the last 13 years. Do you know this? Do you know that? I said, no, I don't know. But I heard a gentleman of our group who was talking about some of these things. So really, for me, I've had some misfortunes, if you want to call them that, in the healthcare delivery system. And in retrospect, putting them in perspective now, I think some of them were rooted in lack of knowledge, I would say, and some of them were rooted purely in racism because of my race. And I try to deal with them in a way that it becomes a learning opportunity for myself and for the individual involved. I think I've shared one interesting story when my daughter had this skin condition, and this dermatologist who had moved here from BC kept on prescribing medication that were not effective, and only to be confronted one day. And I said to her, is there no other medication that can? She said, yeah, there is, but it's expensive, And I got very, very livid when she said it's expensive. And I said, but did you just prescribe it and let her deal with getting it? What do you do for a living? Was the next question she asked me. And I said, oh, I work for the Winnipeg School Division as a consultant. The moment I said that, everything changed. And she apologized, and she gave me another prescription that was very effective, albeit extremely pricey. So, and I know my experience is just one of many, 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 many other examples that exist in the system. In most cases, they go unnoticed or unheard of, or nobody speaks about them, particularly for people that are like myself or who have similar background. And by that, I mean refugees or affected and newcomers. Because for us, like I always say to people that I meet, for us, we come here because we are fleeing from tyranny. And by tyranny, I mean our own governments that use us for their political interests. So we see everybody in authority as part of, as an indirect extension of what we've fled from. So the doctors, the nurses, the police, you name it. So if a doctor or a nurse does something, even we can tell that is inappropriate, we usually don't have the nerve to even confront it because we are afraid what might happen to us. And that goes into we not knowing what our rights are, what our responsibilities are, so for someone like myself who has come to learn that, no, you need to speak up and you have the right as a citizen within the confine of the law to always say what you think, as long as you are not, so really, for me personally, my goal are twofold. To see to it that the demographic that I represent, the issues that are dealt with in the healthcare system, and also to enrich myself by I learn from the wonderful people that I mingle with every so often.
Thank you, Abu. I feel like the common theme, and you weren't here for this, but it's very much people with lived experience, a diversity of people need to be involved in these conversations, both in health research and health services work. You know, we can't make assumptions about people, about why people make decisions they do, about what people are going through. We do need to have these conversations, right? And so that's, you speak again to why engagement is so important. I will mention we are 5 minutes from 1 p.m. I know some folks have to go. Others are welcome to stay and continue discussing.